I obviously was totally pro-vaccine, 100% do the standard vaccine schedule, vaccinated my first child, standard regular vaccine schedule, because that's what I was trained in. However, when you start to practice in a functional or integrative practice, you naturally attract moms to your practice who have vaccine-injured children, who have, admitted, not controversy, the pediatrician, everybody admits it, they've been even compensated by the vaccine fund for injury. So you start to hear these stories over and over. Mama comes in, and this is a pro-vaccine mama taking her baby in for the normal vaccine schedule, and at 18 months, pre-vaccine, the baby was playing patty cake and having eye contact and saying mama. And then after the 18-month vaccines, there was a fever and very unconsolable, probably headache is what was going on because of brain swelling and inflammation. And then there's no more eye contact, no more patty cake, and there's severe developmental delay. When I had 4 or 5 of these moms come to our clinic, again, I was kind of forced to look at the issue again. It's right up in my face. These are real people, real moms. They're not anti-vaccine. They were following the vaccine schedule. So I started to look deeper, and what I came to realize was there's a whole lot more to this. This isn't a one-size-fits-all deal, which we've made it into. Every baby's the same. Every baby starts with the hepatitis vaccine on day of life 1 or 2, and then we follow this routine vaccine schedule that's 2, 4, 6 months, and everybody fits into that box, and there's no questions asked. That I'm very confident that that's not the right way to go. In a healthy baby who's not sick, who's not toxic, who's born to a healthy mama, who has a healthy microbiome, that's the gut flora, who is breastfed. So basically I'm talking about a well baby. That baby can probably handle the regular vaccine schedule. I would contend that most babies born today are born toxic, and that's based out of a study from 2002 where they looked at 10 random babies, pulled the umbilical cord blood from these babies. These are healthy babies, healthy mamas, healthy pregnancies, normal deliveries, and the cord blood on average showed 287 different toxins in the cord blood of this newborn baby. Everything from flame retardants to pesticides to heavy metals. What I'm getting at is these babies, according to the data and the research, are being born toxic. The microbiome is compromised. These mamas who are birthing these babies don't have good gut flora, and we know when the gut flora is not diverse, there's going to be increased risk of vaccine injury. And so most of my parents delay their vaccine schedule, and they do 1 or 2 at a time, the most important ones they'll start with, and they'll move on from there. So that's what I'm a proponent of, is we individualize it, we look at all the evidence, all the data, and get out of these emotional camps of pro and anti, and let's just seek out the truth, which admittedly is hard to find.